Good afternoon, everyone. I'm so glad that you could join us. My name is Kyle Knight. I'm the Community Relations Manager at Legacy Community Health for the San Jacinto Clinic.
Hi, I'm Dr. Hattie Henderson. I'm a geriatrician here in Baytown. I'm here today to talk about how you can stay in tip-top shape and how to identify and address Alzheimer's.
Thank you so much for being here, Dr. Henderson. And what can people within that community do to stay healthy?
The biggest thing is staying physically active, eating a very good diet, and getting their rest. Everyone's physical activities are going to be based on their needs and their abilities. There are people who use walkers or canes, they can't get around as much, but there are those who can engage in more exercise of yoga. They can do aerobics, they can do weightlifting or light weightlifting. But the goal is to maintain flexibility and their balance and keep up their muscle tone and strength. Because as you age, you will tend to lose muscle tone and strength if you're not using it or exercising. So eating more fruits and vegetables are great ways to really help to keep the antioxidants in your body and to improve your overall functional health. Fats and sweets, things that can decrease your immune system. Of course, you're going to have some of those things, but do it in moderation. And resting. Everyone needs 7 to 9 hours of sleep every night. So again, that's good exercise, a great diet, including lots of vegetables and fruits with a little bit of lean meat here and there, trying to avoid sweets and a lot of fats, and getting your rest are great ways to give us overall physical good health.
So what would you say are the benefits of having, a community of friends and family to rely on and connect with in the midst of times like this?
I encourage them to try to develop a social network, what we call social capital. It's the theory that the relationship between people in a group or community help it to function properly. It is important for the mature adults to maintain a lot of these relationships that they have had for years. It keeps their wit sharp. It also provides some level of safety, as many of them live alone. Having a network nearby, if you fall, can make a big difference in someone's overall outcome. Whereas someone who doesn't have a social network, doesn't reach out to people, no one really checks on them, they're likely to be down longer. And we know that the longer someone is down on the floor or after a fall or after an injury, the poorer the outcomes overall. It's also incredibly beneficial for mature adults' mental health to have people to connect with. Daily chats with a loved one, with a friend, with a neighbor to help stave off symptoms of depression.
Well, and something that maybe is a little bit of a different topic, but something that still is very important, I think, is the concept of medications. I'd like you to maybe touch on that a little bit and kind of explain to viewers, what medication management is and why it is so important for a mature population.
Medication management is incredibly important because it can help to ensure that you take the correct medications as well as taking the medication at the correct times. Of course, not doing so, not taking your medications properly can lead to poor outcomes. There are mobile apps, journals, pill cases, there's calendars, there are family members who can call and remind you to take it.
Can you help explain why it's still important to attend annual checkups?
As you age, you can develop more health issues. You can develop high blood pressure, you can develop diabetes, and attending to these issues or finding out about these issues, if you have them, are usually found during checkups. And with annual checkups, we usually do a full physical where we actually try to check, pretty much every organ that we can touch and feel on exam. Plus, we do a detailed medical history. We not only take your history, but we also ask about your family history and your social history, which involves, who's in the home, who can assist you. Do you have any habits such as smoking, drinking, or other issues that may be causing you to have other medical issues at this time? Cognitive screenings are essential. The screenings are meant to catch issues early, such as things such as Alzheimer's and other dementias can be caught early. And we know that if we catch these diseases early, that we have the opportunity to treat them and hopefully to slow the progression of the disease processes. For the majority of the dementias, and particularly Alzheimer's, there is no cure. However, there are treatments and there are ways to slow the progression and to continue to keep you independent in your home. The healthier you are physically and mentally, the more likely you are to be able to maintain your independence in your own environment.
What are the differences between Alzheimer's and dementia, and how do you test and treat for them both?
Many people use the terms interchangeably, dementia and Alzheimer's, but they're not the same thing. Dementia refers to the decline in mental ability that is severe enough to interfere with an individual's daily life, whereas Alzheimer's is the most common cause of dementia. Unfortunately, there is no cure for Alzheimer's, but through the cognitive screenings, we can recognize early signs of the progression. And some of those signs include memory issues, confusion, disorientation, behavioral changes. Many of these changes are usually recognized, though, by those who are in our social network. Most people who develop Alzheimer's are over the age of 65, but many people are not. There are some people who get the disease earlier in life. Alzheimer's is not considered a normal part of aging. We know that if we catch Alzheimer's early, we can stop some of the physical changes that people will endure as the disease starts to progress. But it's very important that people are having conversations about, what their desires are, even at the end of life.
Let's say that I'm a member of the population who,
Mhm.
I live on my own, but I'm starting to have, concerns about either my memory or someone in my family has mentioned that to me. What should I then do, and how can I get in touch with Legacy to address some of those concerns and maybe get a wellness check-in?
Mhm. We encourage people to call and make an appointment with us. The contact center, the number 832-548-5000. Call us and come on in and see us so that we can help you.
You've hit on so many important points. Thank you for joining us, and we hope you have a wonderful day.
Thank you all for coming. Remember, stay active, eat well, and get your sleep.